Hello everyone. Welcome back to a new quick review. We are going to talk about today about the murmurs. This is a high yield topic related for the step 1, and this is a high yield for the step 2 CK as well. So when we are talking about the murmurs, we need to classify the murmurs in two kinds of murmurs: systolic murmurs and diastolic murmurs. The systolic murmurs are going to be the aortic stenosis and the mitral regurgitation. And when we are talking about the diastolic murmur, we need to talk about the mitral stenosis and the aortic regurgitation. And when we are in front of a question that is trying to examine if we are able to know about the murmurs, we need to get some buzzwords or keywords. Those keywords are related with each murmur. So the keyword for the aortic stenosis is crescendo, decrescendo, murmur. The keyword for the mitral regurgitation is the blowing. The blowing murmur is related with the mitral regurgitation. And the snap is related with the mitral stenosis. So if we are getting a question that is telling us that the patient has a diastolic murmur, it's a kind of a snap sound, we are able to say that the patient is getting a mitral stenosis. And for the atrial regurgitation, for the aortic regurgitation, we are getting the keyword related with decrescendo. So if we are hearing about the crescendo, decrescendo, we are able to say that the patient is getting an aortic stenosis. If we are looking for a mitral regurgitation, we need to try to find the blowing sound that is a systolic murmur, okay? And if we are trying to figure out if the patient is getting a mitral stenosis, we need to try to find the snap sound inside of the question. And the same thing for the atrial regurgitation. We need to try to find the decrescendo murmur. And in a different slide, we are going to explain about the 3 murmurs. Those murmurs are the ventricular septal defect, the PDA, and the mitral prolapse. So the ventricular septal defect of VSD is going to give us a kind of murmur that we call harsh. And the PDA is going to give us a kind of murmur that we call like machine. And the mitral prolapse is going to give us a click. And with this quick review, we are finishing our keywords to identify the exactly murmurs that the question is giving us during the step 1. Thank you so much. Please follow us in our YouTube channel and give us a thumbs up. Thank you so much.